the midwife function is what we did at Healthcare for America Now, which is we had a sense of history, and we always believed our job was to have the grassroots establish a relationship with members of Congress so that they actually felt the urgency. They heard the stories of people who couldn't afford their health care. They saw that in their lives. They saw it in their own lives. They felt that we were there behind their backs, helping them out, encouraging them. And from the first work we did in 2008, we had by Election Day, as Gareth said, 140 members of Congress signed on our principles, establishing a relationship then. Through the Tea Party in August, and what the press hasn't told is that, you know, as soon as the Tea Parties happened, members of Congress, Democrats, started calling us and said, we need help. And in the 3 weeks of town meetings Democrats held before Labor Day, we had usually 2 or 3 times as many people for reform as opposed to reform at those town meetings. And that's why members of Congress came back and felt they could pass reform. And, you know, we did a great march from Philadelphia to Washington, ending up in Washington the day before the Blair House Summit. And Harry Reid greeted us and a bunch of other senators. And Michael Myers, who ran Ted Kennedy's committee, wrote me and said, that really fired our members up. And that relationship, that sense that people really cared, had a personal relationship, had members back, that was what I say by the midwives. And it's why we made the field, the grassroots, and now the netroots the key focus of our work. And so my lessons is history does matter, and if you understand that and you can organize a movement for history, you actually can make history.
I thought about the lesson that I drew working in the Clinton administration when we did not deliver health reform. And I had concluded from that experience that what it was going to take to pass the health reform law was to persuade voters, most of whom have health insurance, that they had more to gain than to lose from covering everybody else. And good as the campaign was, we got work to do on that. We really have not achieved that goal. I think we will, but we haven't yet. So I took a different lesson from this campaign and this successful effort, which was that even when we've got not so supportive public opinion, what we can do, and what I think the campaign did, as Richard described, is to persuade members of Congress that they're the ones who can't afford not to deliver the change that we're seeking, that they simply couldn't afford a vote for the status quo. And I think that it was the campaign who contributed mightily to that effort by using all of the resources that we have in a legislative and a social change battle, working together, albeit not always perfectly, but working together on all cylinders all the time. So I think about the research that exposed what I think of as the ugly underbelly of the status quo, and the communications efforts that put the egregious behavior of the insurance industry, made it front page news on a continuing basis, and the ceaseless, tireless advocacy that persuaded members of Congress, as you said, that reform could really address those problems and bring their constituents benefits. And finally, and continuingly, an effective political effort that, just as you said, says that we have your backs and we're supporting you to do the right thing, but we'll support you if you deliver health reform. I think that without that kind of effort, given how close the vote was, I'm good on history, but man, it was really a little touch and go for my taste. I think that without that effort, that we would not be celebrating today. And so what it teaches me overall is that when we're fighting for social change, is that if we use everything we've got 24/7 and use it effectively, we've got a chance at achieving the goals we're committed to. And if we don't, we're up a creek.
I thought about it in terms of a wonderful baseball coach my son had when he was 7 years old. It was his first summer, summer baseball where kids play a lot of baseball. And he was a physicist, actually. He's now at CUNY. But this was outside of Washington. And I like the idea of a physicist in baseball. It makes a lot of sense. But whenever things would go wrong, and in 7-year-old baseball, for those of you who have had any experience, a lot of things can go wrong, he would sort of pull these kids together, and he'd look at them and say, the bases are loaded and you strike out, what do you do? And he'd say, keep coming at them. And then he'd go on, you know, you drop a fly ball and 2 runs score. What do you do? Keep coming at them. And, of course, by the end, the kids would always yell, keep coming at them. And to this day, my son's still playing baseball for his high school. He remembers that. And on a bad day, I remember that, too. And I actually think when you think about this fight, or a lot of the fights for social justice that we've had in our country, an awful lot depends on patience and hanging in there, and yes, you got to keep coming at them. When you think about healthcare reform, and you go back to what Harry Truman said, everything he said in, what was it, 46, that message, or 45, we could say today. It was the same essential goal at that moment. And in the process of getting reform, you have to be willing to absorb a lot of defeats. And I think you can, and then not giving up, keep coming at them. You know, if you look at the New Deal, a lot of the New Deal was introduced in the rather conservative Congresses of the 1920s by a bunch of progressive members of Congress, Fiorello, LaGuardia among them. The Wagner Act was there, the makings of TVA were there, of Social Security in infancy was there. And these progressives went up against a wall, and they lost, but they kept coming at them. And by the time the New Deal came around, the times were ready, and the majorities were ready, and a lot of good things happened. In this case, I think that it's worth remembering that after health care died in the Clinton years, people didn't stop. And what's remarkable about the bill that came out, for all its flaws, and we'll probably talk about what we wish might have happened in addition to what happened, the basic structure had been worked out over a long period of time by a lot of people in the academy and think tanks like Judy, but also by a lot of politicians who were trying to test, well, why did we lose here? What part was unpopular here? Then the president repeating, it was problematic, you'll get to keep what you have. There was a sense that you probably couldn't ever get single payer the first time out. So how do you structure subsidies? And so when you go to the campaign in 2008, if you compare what Barack Obama said, what Hillary Clinton said, and what John Edwards said, if I can bring up his name, and Edwards actually probably had the most progressive of the 3 plans, but they were remarkably similar. And so out of defeats and partial victories like SCHIP, people kept coming at them, kept coming up with new ideas, and finally had a formula ready when the time came for victory, and victory happened.